Good day everyone, I am 𝐬𝐸𝑪𝑒𝑐𝐿𝑒𝑐𝐸 from BSN1 11B, and today I will be showing you my return demonstration in performing the abdominal assessment. So the assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. So the physical examination of the abdomen is very crucial in evaluating the abdominal complaints such as pain, distension, enlarged masses, or organs. So prior to the conduct of the assessment, I am going to review the client's medical record for us to provide focus for the physical examination of the client. Now I am going to determine the scope of the assessment and prepare the necessary equipment needed to conserve time and energy. So the equipment includes a tape measure to measure the patient's abdominal girth, a sharp object such as this ruler for the hypersensitivity test, a stethoscope to listen for the patient's bowel sound, and lastly, a marker to mark at the patient's abdomen. So now I am going to perform proper hand hygiene to deter the spread of pathogenic microorganisms. For the introductory phase, first, we need to introduce ourselves to the client and verify the client using two identifiers. So this is done to know if we have the right client for the right procedure. And after that, ask the client how he would like to be called during the assessment and explain the procedure to the client. So this is to establish rapport with the client and so that the client will feel comfortable during the assessment. Provide the client the opportunity to ask or raise his concerns. And lastly, ensure client's comfort, privacy, confidentiality, and position the client appropriately. So if the patient is a woman, drape their anterior thorax if it is not examined to protect the privacy of the client. Good day, sir. I am 𝐬𝐸𝑪𝑒𝑐𝐿𝑒𝑐𝐸, your student nurse for today. Can I see your wristband, please? Can you state your name?
I am Patrick Anay.
Your birthday?
It's on April 26, 2002.
Okay, now would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'll be doing an abdominal assessment, which means I'll have to expose your abdomen, listen for your bowel sounds, and feel for your internal organs. And during the conduct of the assessment, I am going to touch some parts of your body and there's a lot of movement that you should follow. Would that be alright?
Yes, it's alright.
Okay, so do you have any questions or clarifications before we start?
None so far.
Okay, so Mr. Patrick, is it okay if I'll close the curtains for me to provide you with some privacy and away from disturbances?
Yes, go ahead.
Okay. How about the room temperature? Are you comfortable with it?
Yes, I'm comfortable with it.
Okay, how about your position right now? Are you comfortable with it?
Yes, I'm good.
Okay, so Mr. Patrick, all of the information that will be gathered today will remain confidential and will only be used for medical purposes only. Would that be alright?
Yes, it's alright.
Okay. So now, ensure that the client has emptied his bladder before the examination to eliminate bladder distension and interferences with an accurate examination. Okay, since my patient already emptied his bladder, I will now start the examination. So Mr. Patrick, I need you to change into this gown, please. So now, position the client in a supine position and place a pillow under the patient's knees to ensure abdominal muscle relaxation. Okay, Mr. Patrick, I'm going to place a pillow under your knees, okay?
Okay.
Okay. And now cover the upper and lower part of the patient, exposing only his abdomen from the xiphoid process down to the symphysis pubis. Okay, Mr. Patrick, now I'm going to expose your abdomen, okay?
Okay.
Okay, can you raise your hand, please? Okay, thank you. Okay, Mr. Patrick, I'm going to start now in inspecting your abdomen, okay?
Okay.
Okay. So now begin the inspection of the abdominal skin characteristics such as the temperature and skin color. Okay. Okay, skin is warm to touch. And the skin color is consistent all over. That's good. So now, observe and note for any presence of vascularity, striae and stretch marks, scars, lesions, or rashes. Okay. Okay, so there is no presence of rashes, lesions, scars, or any stretch marks. That is good. Okay? So if there's any, document its history and its location by quadrant. So now to observe for the umbilicus, for its location, color, and contour. So the color of the umbilicus should be the same with the surrounding skin tone or even pinkish. The umbilicus should be recessed or inverted or protruding with not more than 0.5 centimeters, and it should be conical and round. Okay? So the patient's umbilicus is in midline and its color is the same with the surrounding skin tone. Okay, that's good. So now to observe for the abdominal contour, sit beside the client and look across the abdomen at a level slightly higher than the patient's abdomen. Okay, so the abdomen should be evenly flat, rounded, and scaphoid, which is seen in thin patients. So now, to observe for abdominal symmetry, observe for any presence of masses or bulges, which may suggest ventral hernia, or any protrusion on the intestine or tissues through a weakness of the abdominal wall. So ask the patient to raise his head to further assess for herniation or diastasis. So Mr. Patrick, I need you to raise your head, please.
Okay.
Okay. Okay, thank you. So the abdomen should be symmetrical and does not bulge if the patient raises his head. Okay? So, during the inspection of the abdomen, observe for any abdominal respiratory movement when the client breathes, such as aortic pulsations and peristaltic waves. Okay? So there is a slight pulsation in the epigastric area, which is the abdominal aorta, which is normal, but there is no presence of peristaltic wave, which is also normal. Okay? Okay. So now to observe for the abdominal girth, inspect the area between the lower ribs and the pubic bone and note for any presence of abdominal enlargement. Okay. Okay, so there is no presence of abdominal enlargement. That is good. Okay. So now to measure the patient's abdominal girth, place a clean tape measure around the patient's abdomen at the level of the umbilicus. Okay. So in measuring the patient's abdominal girth, it should be at the same time of the day, ideally in the morning after voiding. Okay, Mr. Patrick, can you raise your hand, please? Okay. Okay. So when you are done measuring the patient's abdominal girth, record the distance in centimeters and don't forget to take future measurements on the same location, especially when distension is noted. So when distension is noted, mark at the patient's abdomen to aid in measuring the site. And don't forget to ask the patient not to erase the mark until it is no longer needed. So now I am going to auscultate for the patient's bowel sound. So now, Mr. Patrick, I'm going to listen for your abdomen. So may I just ask, when is the last time you ate?
The last time I ate was last night.
Okay. So I asked the patient since recent intake may have increased the peristaltic activity. So now I'm going to warm my hand and the diaphragm of the stethoscope to avoid startling the patient from the coldness of the stethoscope. So I'm going to sanitize my hand first. Okay, now auscultate all 4 quadrants with at least 1 minute each, starting from the right lower quadrant, proceeding in a clockwise pattern, and note the intensity, frequency, and pitch of the bowel sound. Always remember to apply light pressure in auscultating or just simply rest the stethoscope if the patient's abdomen is tender or painful. So now, Mr. Patrick, I'm going to start auscultating.
Okay.
Okay. Okay. Now for the vascular sounds, use the bell of the stethoscope to listen for bruit. over the abdominal aorta, renal artery, iliac artery, and femoral artery. So now I'm going to listen first for the abdominal aorta. Okay, and now I am going to listen for the renal artery, which is located at both left and right upper quadrant. Okay, and now I'm going to listen for the iliac artery, which is just below the umbilicus and located from both lower, left, and right quadrant. Okay, and lastly for the femoral artery. Okay, so now for the venous hum, use the bell of the stethoscope and listen for venous hum on the areas of the epigastric and umbilicus. Okay. And lastly, for the peritoneal friction rub, use the diaphragm of the stethoscope to listen for friction rubs over the areas of the liver and spleen, which is located at the right and left lower ribs. Okay. So first, I'm going to listen for the splenic friction rub, which is located at the left upper quadrant. Okay, and now I am going to listen for the hepatic friction rub, which is located at the right upper quadrant. Okay, that's good. Proceeding now on the percussion of the patient's abdomen, since several areas of the four quadrants determine any presence of tympany and dullness. So tympany is a high-pitched musical sound which indicates hollow space filled with air, and dullness indicates fluid or feces. So the percussion may proceed in a clockwise pattern or up and down method. So I'm going to use first the clockwise pattern of percussion. So now, Mr. Patrick, I'm going to percuss your abdomen, okay?
Okay.
Okay, so now I'm going to start at the right upper quadrant, ending at the suprapubic region or the epigastric region. So I'm going to start percussing. Okay. Okay. So now percuss the vertical liver span at the midclavicular line. So start percussing at the right lower quadrant, percuss upward towards the liver, and note the change of tone from tympany to dullness and mark at this point. So Mr. Patrick, is it okay if I'll mark at your abdomen?
Yeah, go ahead.
Okay. And now percuss the upper border of the midclavicular line at the areas of lung resonance surrounding the third intercostal space. So percuss downward towards the liver and note the change of tone from lung resonance to liver dullness and mark at this point. And now measure the distance in centimeters and repeat the whole procedure to the mid-sternal line. Okay, so I'm going to measure. Okay. So now, to percuss the vertical liver span at the mid-sternal line, start percussing just above the umbilicus, upward towards the liver, and mark the change of tone from tympany to dullness and mark at this point. And then percuss the upper border of the mid-sternal line. So start percussing at the body of the sternum along the third intercostal space and percuss downward towards the liver and mark the change of tone from flat to liver dullness and mark at this point. And then measure the distance using centimeter ruler. Okay. So the normal liver span at the mid-clavicular line is between 6 to 12 centimeters and along the mid-sternal line is 4 to 8 centimeters. So now, to percuss for the liver descent, locate the liver border of dullness and ask the patient to take a deep breath and hold his breath while you percuss from the right lower quadrant towards the liver and note the change of tone from tympani to dullness and mark at this point. So Mr. Patrick, I need you to take a deep breath. Okay, and then exhale. Exhale and then hold your breath, please. Okay, thank you. Okay, you can now relax. And then measure the distance in centimeters between the lower border and the right costal margin along the mid-clavicular line. Now to assess for the spleen and evaluate for splenomegaly, begin percussing at the posterior towards the left mid-axillary line and percuss downward and note the change of tone from lung resonance to splenic dullness. So Mr. Patrick, I need you to face at your right side, please.
Okay.
Okay. Okay. So now perform the second method of percussion to assess for splenic enlargement by asking the patient to take a deep breath and then start percussing at the last left interspace at the anterior axillary line. So Mr. Patrick, I need you to take a deep breath. Okay. Okay. So resonance or tympani is mostly heard on the last left interspace. Now perform the liver blunt percussion to assess for liver tenderness. So ask the patient to sit with his back to you. So Mr. Patrick, I need you to sit on the bed, please.
Okay.
Okay. And then place your left hand fist on the lower right anterior rib cage. Okay. And then use the ulnar side of your right hand fist to strike to your left hand. And then note for any presence of tenderness upon percussion. So Mr. Patrick, tell me if you feel any pain, okay?
Okay.
Okay.
No. 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 No.
Okay. So now, perform the kidney blunt percussion to assess for kidney tenderness. So ask the patient to sit with his back to you and then place your left hand flat on the costovertebral angle at the level of the 12th rib and then use the ulnar side of your right hand fist to strike your left hand and note for any presence of tenderness upon percussion. So Mr. Patrick, tell me if you feel any pain, okay?
Okay.
Okay.
No. No. No.
Ayan, put on this side.
No. 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 No.
Okay. You can now lay back on the bed. So now to assess for abdominal distension, bulges, flunks, and ascites, while the client lies supine on the bed, percuss the flunk of the patient from the bed upward towards his umbilicus and note the change from dullness to tympani and mark at this point. Okay, And now reposition the client in a side-lying position and percuss his abdomen from the bed upward, and note the change from dullness to tympany and mark at this point. So Mr. Patrick, I need you to face on your left side, please.
Okay.
Okay. Okay. Okay, you can now roll back. So now for the fluid wave test, while the client is lying supine on the bed, ask the client to press the edges of his hand firmly down the midline of his abdomen. So Mr. Patrick, I need you to place your hand here and then press it down for me, please.
Okay.
Okay. And then firmly place the palmar surface of your fingers at one side of the patient's abdomen, and use the other hand to tap on the opposite of the abdominal wall and note for any fluid movement. Okay. So now for palpation, position the client in a supine position and cover his upper and lower parts of the body, leaving only his abdomen exposed. And now begin light palpation on non-tender quadrants using your fingertips to compress all the quadrants in a depth of 1 centimeter in a dipping motion, and gently lift your fingers and proceed to the other quadrant. Okay, and now begin the deep palpation on all quadrants to delineate organs. So use the palmar surface of your fingertips to compress all the quadrants at a maximum depth of 5 to 6 centimeters, and note for any resistance or deeper structures. Okay, and use bimanual palpation if resistance and deeper structures are felt. Okay. And now to palpate for masses, use your fingertips to compress all the quadrant at a depth of 1 centimeter in a dipping motion. Note for any masses and assess for its location, shape, size, consistency, demarcation, pulsatility, tenderness, and mobility. Okay, and now to palpate for the abdominal aorta, use your thumb and your first finger, or use both of your hands to palpate deeply and assess for pulsations. I'm going to use both of my hands in palpating the abdominal aorta. Okay. So now perform moderate palpation on the umbilicus and its surroundings while noting for any presence of masses, bulges, and swelling. Okay. Now palpate for the liver to assess for liver contour, surface, presence of nodules, tenderness, and irregularities. So stand at the right side of the client and place your left hand under the client's back at the level of the 11th and 12th ribs, while the right hand is laid parallel to the right costal margin with fingertips pointing towards the client's head, and then ask the client to inhale, then compress upward and inward with fingers and note for its consistency and tenderness. Okay, Mr. Patrick, I need you to take a deep breath, please.
Okay.
Again, please. Okay, again, please. Okay. Okay, now perform the hooking technique by standing at the right side of the client's chest, and then hook your fingers of both of your hand over the edge of the right costal margin, and ask the patient to take a deep breath, and then gently and firmly pull inward and outward with the fingers, and then note for consistency and tenderness. So Mr. Patrick, I need you to take a deep breath, please.
Okay.
Okay, again, please. Okay. So now to test for Murphy's sign or to test for cholecystitis. Press your fingertips at the liver border at the right costal margin and ask the client to inhale deeply and note for any increase in pain felt and tenderness. Okay, so Mr. Patrick, I need you to inhale deeply and then tell me if you feel any pain, okay?
Okay.
Okay, can you take a deep breath, please? Okay, do you feel any pain?
No.
Okay. So a positive Murphy sign is when pain occurs when the examiner's hand comes in contact with the gallbladder. Now palpate the spleen and assess for splenic enlargement. Again, stand at the patient's right side and reach over the patient's abdomen with the left hand under the posterior lower ribs and pull up gently and place the right hand below the left costal margin with fingers pointing towards the patient's head, and then ask the patient to take a deep breath and then press inward and upward using the right hand as the left hand provides support, and note for consistency and tenderness. So Mr. Patrick, can you take a deep breath, please?
Okay.
Again, please. Okay, and now repeat the procedure while the client is lying on the right side. Palpate the spleen by moving it upward and downward, and then document the size in centimeter and note for consistency and tenderness. Okay, Mr. Patrick, I need you to face on your right side, please.
Okay.
Okay, and I need you to take a deep breath.
Okay.
Okay, again, please. Okay. Okay, now roll back. Now palpate the kidneys to assess for kidney enlargement. Place your left hand on the right posterior flank to provide support, and place your right hand on the right upper quadrant below the costal margin at the mid-clavicular. Instruct the client to exhale and hold his breath briefly, and then gradually release the pressure of your right hand and repeat the steps for the left kidney. Okay, Mr. Patrick, I need you to take a deep breath, please, and then exhale and hold your breath for a moment, okay? Hold your breath, please. Okay, you can now relax. So now to assess the urinary bladder, and begin palpating at the symphysis pubis and move upward and outward to estimate the bladder borders, and then note for consistency and tenderness. So now for the hypersensitivity test, using a sharp object, stroke the patient's abdomen or grasp a fold of skin with your thumb and index finger and quickly release it. Repeat the step several times and note for pain or exaggerated skin reaction. So I'm going to use my ruler to stroke at the patient's abdomen. So Mr. Patrick, tell me if you feel any pain, okay?
Okay.
Okay, do you feel any pain?
No.
Okay, how about on this side?
No.
Okay. Now to test for 𝐬𝐤𝐚𝐥 sign, reposition the patient on his left side position and then hyperextend his right leg. Note for pain and reaction from the patient. So Mr. Patrick, I need you to face on your left side, please.
Okay.
Okay. Okay, so I'm going to hyperextend your right leg and tell me if you feel any pain in your abdomen, okay?
Okay.
Okay, do you feel any pain?
No.
Okay. So pain in the right lower quadrant or the 𝐬𝐤𝐴 sign is associated with the irritation of the iliac muscle, which is due to appendicitis. So now to test for the obturator sign, now support the client's knee and ankle and then flex the hip and leg and rotate the leg internally and externally, and then note for any pain and reaction from the client. Okay. So I'm going to test for the obturator sign. I'm going to flex your leg. So tell me if you feel any pain in your abdomen, okay?
Okay.
Do you feel any pain?
No.
Okay. Do you feel any pain?
No.
Okay. So pain in the right lower quadrant is associated with irritation of the obturator muscle, which is due to appendicitis or perforated appendix. So now to assess for appendicitis or peritoneal irritation, rebound tenderness or Blumberg sign, palpate deeply at 90 degrees into the abdomen away from the painful or tender areas and then suddenly release the pressure. Listen and watch at the client's expression of pain as the client describes which hurts more, the pressing in or the releasing, and where in the abdomen the pain occurs. So, Mr. Patrick, do you feel any pain when I was pressing your abdomen?
No.
How about when I was releasing the pressing in your abdomen?
No.
Okay. So, pain induced or worsened by withdrawal is rebound tenderness, which suggests peritoneal inflammation. Now, for the referred rebound tenderness, palpate deeply at the left lower quadrant and quickly release the pressure. So, Mr. Patrick, do you feel any pain when I was pressing your abdomen?
No.
How about when I was releasing the pressing in your abdomen?
No.
Okay. So pain in the right lower quadrant during the pressure in the left lower quadrant is referred or positive for Robsing sign, which indicates acute appendicitis. So now, Mr. Patrick, we are now done with the assessment. So you can now change your clothes. So now I'm going to summarize all of the information obtained during the working phase, and I'm going to discuss the findings to the client and the possible plans to resolve health concerns if present. So now, Mr. Patrick, I'm going to summarize all of the information that I have gathered. First, when I was inspecting your abdomen, your skin is uniform in color and temperature. There's no lesions, scars, or rashes present, or any abnormalities present. That is good. So your umbilicus and your navel is in midline and inverted, which is normal. Your abdomen is symmetrical, which is also good. So upon auscultating for your bowel sound, I heard no bruise or any abnormal sound, which is good. So your liver span in the midclavicular line is 7 centimeters, while in mid-sternal line is measured at 6 centimeters, and your liver descent is 2 centimeters, which is in normal range, okay? So upon percussing and palpating for your abdomen, there were no tenderness, masses, bulges, or swelling, which is good. So overall, your abdomen is in normal condition and it is doing pretty well, okay?
Okay.
So do you have any questions or clarifications about all the informations?
No, everything is clear.
Okay. So, Mr. Patrick, I highly advise you to, as much as possible, avoid drinking too much alcohol because it might cause damage to your liver, but instead, drink plenty of water to flush out all the residues in your stomach. Okay? And, of course, if you have the urge to pee, do not hold back because it might cause the bacteria to multiply and may cause urinary tract infection. Okay?
Okay.
Okay, so again, do you have any questions or clarifications?
No, none so far.
Okay, so I think that's it, Mr. Patrick. So thank you for your cooperation and have a nice day ahead.
Thank you so much for your service.
Okay. So now that I'm done with the assessment, I am now going to perform proper hand hygiene to deter the spread of pathogenic microorganisms, and I'm going to record all the information obtained during the assessment on the client's record. So that's it for my return demonstration. Again, I am 𝐬𝐞𝐝𝐢𝐚𝐥 from BSN 111B. Thank you for watching.